Dear friends, welcome to Know Thyself YouTube channel. Good morning. Hope you are all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last episode of Know Your Mind segment, we elaborated on the nature and characteristics of hearing disorders. In this episode, we analyze the classification of hearing disorders by analyzing their different types. In order to understand the types of hearing loss associated with hearing disorders, we must understand how hearing works in a person with functional hearing ability. Sound waves enter the ear, move down the auditory canal, and hits the eardrum, which vibrates. The vibrations from the eardrum pass to the three bones known as ossicles in the middle ear. These ossicles amplify the vibrations, which are then picked up by small hair-like cells in the cochlea. These move as the vibrations hit them, and the moving data is sent through the auditory nerve to the brain. When the brain processes the data, a person with functioning hearing ability will interpret it as a sound. Hearing loss associated with hearing disorders is classified into three categories. First categorization is based on the failure in the process of hearing. The second grouping is based on when the hearing loss occurs. And the third classification is based on where the hearing loss occurs. Based on the failure in the process of hearing, we can classify hearing loss associated with hearing disorders into three types: conductive hearing loss, sensorineural hearing loss, and mixed hearing loss. Based on when hearing loss occurs, we can categorize hearing loss associated with hearing disorders into two types: prelingual hearing loss and post-lingual hearing loss. Based on where the hearing loss occurs, we can speak of two types: unilateral hearing loss and bilateral hearing loss. We briefly consider each of these. First, conductive hearing loss. Conductive hearing loss occurs when vibrations created by sound waves in the eardrum are not passing from the outer ear to the inner ear, especially to cochlea. This type of hearing loss occurs due to an excessive buildup of earwax, a glue ear that is an infection with inflammation and fluid buildup, a punctured or defective eardrum, and malfunctioning of ossicles. Ear infections can reduce eardrum function, while ossicles can become impaired due to infection, trauma, or fusing together or rigidity of the ear bones. Second, sensorineural hearing loss. Sensorineural hearing loss occurs due to the dysfunction of the inner ear, the cochlea, the auditory nerve, or brain damage. This type of hearing loss normally happens due to damaged hair cells in the cochlea. As humans grow older, the hair cells lose some of their function and hearing deteriorates. Long-term exposure to loud noises and high-frequency sounds is another reason for the damage of the hair cells. Total sensorineural hearing loss may occur as a result of congenital deformities, inner ear infections, or head trauma. Third, mixed hearing loss. Mixed hearing loss is a combination of both conductive and sensorineural hearing loss. It happens due to long-term untreated ear infections, which can damage both the eardrum and the ossicles. This type of hearing loss often cannot be rectified. Fourth, prelingual hearing loss. Prelingual hearing loss consists in the inability to hear partially or fully before you learn to utter a word or understand it. Thus, individuals with prelingual hearing loss are either born with congenital deformity or have lost their hearing ability during infancy. As a result, they tend to have slow language development, particularly if they and their parents or caretakers do not know the sign language. Since oral language development and ability to use social cues are closely related, children with prelingual hearing loss can become socially isolated unless they attend a school that has a special needs department to care for them. Besides, children with profound prelingual hearing loss may find themselves outside the peer group circle, as they and their condition may not be fully accepted by the peers. Fifth, post-lingual hearing loss. Post-lingual hearing loss consists in the hearing loss occurring after a person has acquired the ability for spoken or written language. They have acquired the facility for spoken or written language before their hearing is diminished. A medication side effect, trauma, infection, or disease can gradually bring about post-lingual hearing loss. Feeling of isolation is a common problem with individuals suffering from post-lingual hearing loss, which can sometimes lead to loneliness and depression as they have to face the often distressing process of coming to terms with this disability. This condition can also pose challenges for family members, loved ones, and close friends who have to adapt to the hearing loss of their dear ones. A gradual and undiagnosed post-lingual hearing loss can lead to the misconception that the affected person is becoming more distant, and when coupled with miscommunication can place strains on relationships. Sixth, unilateral hearing loss, also known as single-sided hearing loss, consists in an individual having hearing loss just in one of the ears. Persons with unilateral hearing impairment may find it hard to carry on a conversation if the individual conversing with them is on their affected side. Pinpointing the source of sound may be more difficult when compared with those who can hear well in both the ears. Single-sided hearing loss can also make it hard to understand what the other people are saying when there is a lot of environmental noise. Babies born with unilateral hearing loss tend to have developmental speech delays. Children may find it harder to concentrate when they go to school. Social activities may be more challenging than they are for children with no hearing problems. Seventh, bilateral hearing loss. Bilateral hearing loss, also known as both-sided hearing loss, consists in having hearing impairment in both the ears. Persons with bilateral hearing loss would experience many of the difficulties individuals with unilateral hearing loss go through in life, of course, to a much greater extent and to a larger degree. In the next episode, we will talk about causes, diagnosis, and treatment of hearing disorders. Thank you for watching this video. Stay blessed until we see you again with another video.